What's up, everybody, and welcome back to the channel. My name is Rachel Graham, and I'm a registered nurse, a digital creator, and a mom. And today I'm going to be talking about blood clots can kill, DVTs, and pulmonary embolism. You do not want to miss this one, you guys. So, have you ever been on a long flight and noticed leg pain or swelling afterwards? Or maybe you've heard the term blood clot tossed around but weren't really sure what it meant. So today we're talking about deep vein thrombosis, or a DVT. So this is a potentially serious condition that affects hundreds of thousands of people each year. Knowing the signs can save your life or someone else's. So let's get into it, you guys. So, what is a DVT? Deep vein thrombosis happens when your blood thickens and it clumps together. In other words, it forms a blood clot. And it happens in a deep vein, most commonly in the lower leg, the thigh, or the pelvis. These veins are called deep because they run deep inside your body, unlike veins that you can see near the skin surface. So why is this dangerous? So if that little clot or big clot breaks any portion of that, the whole thing or a piece of it breaks free, it can travel through the bloodstream and it bypasses, it goes through the heart and it can get stuck in your lungs, which causes a pulmonary embolism, or a PE. This is a life-threatening emergency. So DVT isn't just a leg issue, it's a whole body systemic risk. So that's why early detection and prevention are super important. What are the signs of a DVT? Swelling in one leg, especially the calf, pain or tenderness that can often feel like a cramp, warmth or redness on the skin. Sometimes there's literally no symptoms at all. Risk factors. You might be wondering, am I at risk? So here are the biggest factors that increase your chances of developing a DVT. Prolonged immobility, such as long flights, car rides, or hospital stays, recent surgery or injury, especially involving the legs, pregnancy and postpartum period, use of hormone therapy or birth control pills, smoking, obesity, and a family history of clotting disorders. How to lower your risk. We're all about prevention on this channel. So, how are you going to lower your risk of getting a DVT? Wear compression stockings if you're at risk or advised by your doctor. You may be wondering, well, who's at risk? Well, if you're pregnant, if you're obese, if you smoke, quit smoking, but if you're a nurse, like me, am I wearing compression stockings? No, I'm not. I should probably take my own advice, right? Move around regularly, especially on long trips. So you want to aim to stand, stretch, or walk every 1 to 2 hours. You want to stay hydrated. I harp on you guys about this. Dehydration can actually make your blood thicker. Avoid sitting cross-legged for long periods. This is for you women especially. And then maintain a healthy weight and avoid smoking. So for people who are at high risk for this, doctors may actually prescribe a blood thinner during hospital stays or recovery periods just to avoid this. So, what happens if you're actually diagnosed with a DVT? So, treatment actually starts immediately to prevent the clot from getting bigger or breaking loose and traveling to the lungs. So, they're going to put you on an anticoagulant. That's a blood thinner. So, that helps it helps prevent the clot from growing and it reduces the risk of new clots. So, heparin, that one's given IV or injection for the first dose. Warfarin or Coumadin, DOACs or direct oral anticoagulants like Eliquis or Apixaban, Xarelto or Rivaroxaban. Don't judge me on my pronunciations, you guys, or Pradaxa or Dabigatran. So treatment on these medications usually lasts 3 to 6 months, but maybe longer depending on risk factors. So again, continued, what happens if you're diagnosed with a DVT? They may put you on a thrombolytic. This is a clot buster. Used only in severe cases where the DVT is really large or if there's actually a PE going on or a pulmonary embolism. That medication will dissolve that clot very quickly, and it's given in the hospital via IV or catheter directly into the clot. There's a higher risk of bleeding for this, so use cautiously. And then compression stockings, they're going to recommend to reduce swelling and help prevent post-thrombotic syndrome, which is chronic leg pain or swelling after a DVT. So usually you have to wear compression for 2 years or so after a DVT. So it's going to help improve blood flow in the legs and send that blood back to the heart. Obviously, you want to try to keep your legs up and engage in activity. That will reduce swelling, and staying active, obviously circulation is improved, so walking is encouraged, and to avoid long periods of immobility. So There also is something called a inferior vena cava filter. It's a tiny filter placed in the large vein that catches clots before they can actually reach the lungs. This is reserved for patients who can't take blood thinners for whatever reason, or they keep getting clots despite treatments. And so, just as a disclaimer, treatment really depends on the clot location, the size, and the patient's overall health. And regular blood work may be needed, especially with warfarin. You will definitely need to monitor your INR. And stopping treatment too early can lead to recurrence. So, what is a pulmonary embolism exactly? So, I mentioned that a blood clot can break loose from a DVT in those deep veins in the leg, traveling through the bloodstream, and it causes a sudden blockage in a pulmonary artery in your lung. So that it's cutting off blood flow to that area, right? So no blood flow means no oxygen, and the longer that remains in that state, that part of the lung is dying. So some signs and symptoms you may experience would be shortness of breath, sharp chest pain, a rapid heart rate, coughing, sometimes with blood. Reducing oxygen levels will cause you to feel lightheaded, sweating, anxiety, a feeling of impending doom, heart failure, and sudden death. So I'm circling back to one of the risk factors. And this is something when I see people smoking, I just want to go up to them and be like, dude, like, why are you smoking? I mean, I used to smoke and I get it kind of, but at this point in 2025, it's like there's so much evidence. Like back in the day, people didn't, you kind of knew it was bad, but like at the point we're in now, there should be absolutely no excuse for anybody smoking cigarettes. Like I'm sorry if that's harsh, but it's true. So smoking plus DVT equals very, very dangerous combo. Smoking does three major things that make blood clots worse. So, this is if you were diagnosed with a DVT and you are a current smoker. You need to quit smoking yesterday, ASAP. So, what it actually does when you continue smoking while you have a DVT, it increases blood viscosity. The thicker your blood is, obviously, the higher the chances of it clotting, right? Smoking damages blood vessel lining, making it easier for clots to form and then also dislodge. And then smoking reduces oxygen levels, which is adding extra stress to your heart and lungs. And you're already at risk for that if a PEE occurs, right? So here's some facts. People who smoke and have a DVT current together are 2 to 3 times more likely to develop a PE than non-smokers with a DVT. 2 to 3 times more likely. Smoking increases the recurrence of blood clots, meaning a new DVT or PE is more likely to happen in the future. And smokers with a DVT have a higher risk of death from complications just from being a smoker. Medications like blood thinners also might be less effective if you're a smoker. So this is related to inflammation and the vessel damage. So it's really, really important that you quit smoking. Final word, quit smoking, ASAP. Stick to your prescribed treatment, whatever that is, by your provider. Make sure you're staying active and well hydrated, and follow up with your healthcare team. So, deep vein thrombosis can be silent. There can be no symptoms, you guys, or very mild, minimal symptoms, but the risks are very clear. If you have any of the risk factors of a DVT, talk to your provider right away. If you have any of those symptoms, go back in this presentation and look at those signs and symptoms. If you experience shortness of breath, chest pain, rapid heart rate, or leg pain or swelling, this could be a sign of a pulmonary embolism, and you need to contact emergency services ASAP, you guys. So thank you for watching this video. If you like it, then like and subscribe. I'll see you in the next one.